Hello again, everyone. Welcome to Health Bites, that channel that tells you about health conditions, what they are, symptoms, treatments, and preventative measures, if any. So, today we're going to talk about ADHD. People also refer to it as ADD, but that's an old terminology. So ADHD means attention deficit hyperactivity disorder. So what is ADHD? Attention deficit hyperactivity disorder, ADHD, is a chronic condition characterized by impulsive behavior, inattention, and hyperactivity. It's usually diagnosed in childhood, but symptoms of ADHD can continue through adolescence and adulthood. So it may also be diagnosed for the first time in adults. So sometimes what they're basically saying is that when we think of ADHD, we mostly think of it being a childhood based disorder. We mostly think that children are the ones that experience it, but adults on a lesser extent also experience this disorder. So what's the difference between ADHD and ADD? So the meaning of ADD is attention deficit disorder, which is an older term for what is now known as ADHD, which is attention deficit hyperactivity disorder. While some people still use the terms ADD and ADHD interchangeably, and may call condition ADD if a child only has trouble focusing but isn't hyperactive, ADHD is officially recognized as the correct diagnosis of the condition by the current version of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM. So, what are the types and symptoms of ADHD? There are three forms or quote unquote presentations of ADHD. The three are predominantly hyperactive, impulsive. People with this type of ADHD mostly struggle with hyperactivity and impulsiveness, although they may also have some symptoms of inattentiveness. Hyperactivity includes constant movement and excessive fidgeting and talking. In adults, this may take the form of exaggerated restlessness and an activity level that often other people find tiring. Impulsivity involves making important decisions and taking action without thinking through the consequences, especially when those actions might be harmful or detrimental and the resulting effects long lasting. Impulsivity is also marked by a desire for instant gratification. In social situations, an impulsive person might interrupt others to an extreme degree and be quick to grow impatient, frustrated, or angry. Category number two, predominantly inattentive. People in this category mainly have symptoms of inattentiveness, although they may still have problems with hyperactivity and impulsiveness. This form used to be and sometimes is called ADD. Inattentiveness is characterized by struggling to stay focused, being easily distracted from the task at hand, and a lack of persistence or organization. This can result in professional and personal difficulties, a lack of attention to detail, and missing important deadlines, meetings, and social functions. Combined hyperactive, impulsive, inattentive. This is third form. People in this group have symptoms of hyperactivity, impulsiveness, and inattentiveness. Most children have this combined type, but the most common symptom of ADHD in preschool age children is being quite hyperactive. And we all know what hyperactive means. They can't stay one place. They always seems like they're energized, that they're the energizer bunny. Children who are hyperactive may talk excessively, squirm and fidget, and have trouble sitting still. In childhood, rather, impulsivity can take the form of impatience, disruptiveness, and difficulty waiting for a turn. Inattention can include daydreaming, difficulty following instructions, forgetfulness in daily activities, and they may also experience trouble focusing. In adults, ADHD symptoms may take the form of impulsiveness, frequent interrupting, restlessness, inability to concentrate, a lack of organization and follow through, difficulty meeting deadlines, frequent mood swings, and struggling to cope with stress. So, how is ADHD diagnosed? How is attention deficit hyperactivity disorder diagnosed? Though many people lose focus, get distracted, and act impulsively on occasion, these behaviors are more severe and more frequent for people with ADHD. Without proper identification and treatment, these behaviors negatively affect their quality of life, whether it's at home, school, work, or any other social situations. There is no one ADHD test to diagnose the disorder. A thorough evaluation by a professional, such as a psychologist, psychiatrist, pediatrician, or clinical social worker, is necessary for a proper diagnosis, which rules out other conditions and considers possibly coexisting conditions. The process involves several steps, and your healthcare provider may perform a full medical exam and get a detailed medical history, as well as conduct interviews with family members to gather a personal history. How does ADHD affect children? Children with this disorder typically have symptoms that cause problems at home, school, or any other social situations. Parents and teachers often mistake signs of ADHD for emotional or behavioral problems. So that's how it affects children. In adults, however, it can cause problems with relationships, work performance, and self esteem. Many adults with ADHD don't know they have it. They may only know that everyday tasks are challenging. Symptoms can change over time. Some people notice that their symptoms improve as they age, while others continue to struggle. So, what causes ADHD and risk factors for ADHD? Experts aren't sure what causes ADHD. Research suggests that the disorder has a strong neurobiological basis and that hereditary is a major factor. Neuroimaging studies, including MRIs to look at the brain structure, have found a consistent set of neural circuits to be associated with ADHD. These circuits are related to sustained attention, control of inhibitions, motivation, and regulation of emotions. Imaging studies have shown that certain areas of the brain are smaller in children with ADHD compared to children who don't have ADHD. Two meta-analyses found that these differences in brain volume are no longer detectable in adulthood, suggesting that ADHD symptoms may be due in part to delays in development or maturation. It goes on to say that several factors may increase a child's likelihood of developing ADHD, attention deficit hyperactivity disorder. These may include, but not restricted to, genetics. Genetics appear to play the largest role. ADHD has been shown to run in families, and studies have estimated that heritability may range from 60 to 90%. So they're saying that it might be passed on from mother and father or both to the child. Heritability. Although the specific genes at play have not yet been identified, scientists believe multiple genes may be involved because it's a complex condition. These genes may have to do with the processes of certain neurotransmitters, such as dopamine, which plays a role in the brain's reward systems and in regulating movement and impulsivity. Another condition that may cause it is environmental exposure to toxins and chemicals, especially lead, which might be a major factor. Alcohol or tobacco use during pregnancy may also be another cause. This has been associated with ADHD symptoms in children in a number of studies, but more research has questioned whether the use of these substances which are alcohol and tobacco, directly causes ADHD. Pregnant women should refrain from alcohol consumption and smoking because of other well-established risks. So they're saying that even though ADHD might not be a direct cause from alcohol consumption or tobacco usage during pregnancy, there are other risk factors, so pregnant women should not be using these substances while they're pregnant. Traumatic brain injury in early childhood has been linked to the development of psychiatric disorders. Among those disorders, ADHD is the most common, with a prevalence of about 20%. TBI, which is traumatic brain injury, is not uncommon. More than 1 million children and young adults seek emergency treatment for it each year in the United States. Another factor that might cause ADHD is premature birth or low birth rate. This might increase the risk of ADHD. Some research has suggested a correlation along a gradient, that the lower the birth rate or the higher the preterm level, the greater the risk of ADHD. Dietary and behavioral factors such as consuming too much sugar or food additives or excessive screen time. Excessive screen times mean watching TV, having smartphones, tablets, computers, have been associated with ADHD. While these factors may affect or exacerbate symptoms, research doesn't support claims that they directly cause ADHD. So, some complications of ADHD might include poor self-esteem, accidents and injuries, substance abuse, delinquent or risky behavior, trouble interacting with peers, relationship difficulties, excess weight and eating disorders, sleeping problems, etc. More than two-thirds of people with ADHD have at least one other coexisting condition, whose symptoms can sometimes be hard to distinguish from those of ADHD. Children with ADHD may be more likely to have other conditions such as anxiety, learning disabilities. They may also seem depressed. They might have a bipolar disorder. which is a condition characterized by periods of depression and manic behavior. Oppositional defiant disorder, which is a condition characterized by a pattern of hostile behavior toward authority figures. Conduct disorder, a condition characterized by behaviors such as lying, stealing, fighting, bullying, etc. Tourette syndrome, which is a neurological disorder characterized by nervous tics and repetitive mannerisms. Sleep disorders and bedwetting. So, is there any treatment for ADHD? While there is no cure for ADHD, the right treatment approach can help control many of these symptoms. This usually involves taking medication, learning certain behavioral strategies, and implementing lifestyle changes to help with focus and organization. Medication is recommended for children 6 years of age and older. Medications used for treating ADHD sometimes include stimulants, non-stimulants, and sometimes antidepressants. For children under 6 years of age, recommendations include behavioral therapy as the first line of treatment before giving these children under 6 years old medication. So, in essence, untreated ADHD can lead to emotional and physical complications, including poor self esteem, accidents, injuries, relationship difficulty, and/or sleeping problems. People with ADHD may also benefit from counseling, especially behavioral therapy, to improve their behavior and their social skills. Parents and other family members may participate in counseling to help develop strategies for dealing with problematic situations. Proper comprehensive treatment can help control ADHD and lead to an improved quality of the person who has this ADHD symptom. So there goes the end of our very short ADHD lesson. What are the causes? Or what are the possible causes? What are the possible treatments? And how it can be alleviated? How it can be put on the down low? How it can be treated? So, if you like my video, you can leave a comment below, leave a like, subscribe to my channel. The link is in the description below the video. So click that like button, subscribe, hit the bell notification so you will be notified every time I release a video. In my video description, I also have other recommended materials that you can use that are health related. You can purchase them if you want. So you can do that to support my channel. So until the next time, I'll be releasing more videos about health related topics, what the disorder is, how it can be treated if possible, how it can prevent, how it can be prevented if possible, and how it can be cured if possible. So until the next time, this is Health Bites. See y'all